CBC questions aren't about memorizing numbers, it's about recognizing patterns. Let's do a quick CBC review the exact way the exam tests it: symptoms, vitals, and then labs. When a test question presents your patient's labs and an infection is suspected, the CBC section you care the most about is the WBCs and the neutrophils. That's what helps you decide if you need to assess more, you can implement, or you need to call a rapid. When your patient has elevated WBCs, look at your patient's neutrophil count. If the neutrophils are elevated, that patient definitely has an infection. Now, let's match the labs with the vitals. Fever and tachycardia goes hand in hand with an infection. On exams, once you have enough data to safely implement, you should provide nursing interventions first to stabilize the patient, and then notify the provider. Before giving any medications, you should know the side effects and the labs that medication may affect. Or you should know the side effects to look for with those medications, as well as the labs that medication may affect. When WBCs and neutrophils are high on exams, you should be thinking, hey, where is this infection coming from as it relates to the patient's symptoms, and what tests can be ordered to confirm? And a good test taking tip, guys. If you suspect a test to be ordered, make sure you know how to prepare that patient for that test. So let's flip the script. Let's say you have a test question and the patient has signs of infection, but they have a low WBC. What do you do? That's a mismatch because fever normally goes with a high WBC, so you must assess first. If your patient has a fever with low WBCs, make sure you assess their past medical history. That history tells you if their low WBCs are expected or if it's a danger sign. You know, with low WBCs, the nursing priority should be infection prevention. So you will teach your patient ways to prevent infection, and if they go home with the low WBCs, you will tell them to notify the office or come back when they have signs of infection. So let's wrap it up, guys. When do you implement first? If there are nursing interventions you can provide before notifying the provider. When do you notify the provider first? If your patient's vitals are abnormal but stable. When do you call a rapid? If their ABCs are crashing. So while you're taking your exams, before you choose an answer, be sure to think, do I need to assess more or can I safely implement? What can I do first to stabilize the patient? Where is this infection possibly coming from as it relates to the patient's symptoms? What tests can confirm it? And what should the nurse do before and after the patient gets that test? And what should the nurse teach the patient to do before, during, and after that test? Use this framework when your test question presents with patient labs, and then ask you what to do next. See you guys in the next video where we apply this framework to NCLEX-style test questions. Bye.